Today we are going to talk about genetic disorders. The first disorder we're going to talk about is severe combined immune deficiency disorder. Remember, you can ask questions anytime. Yes, Sophia?
Are there other names for this disorder?
Yes. Some alternate names for this disorder are SCID, alphocytosis, Glanzmann-Reiniger syndrome, severe mixed immune deficiency syndrome, thymic alphoplasia, and bubble boy's disease. Yes, Sophia?
Why was the name chosen?
It was chosen because of an absence of a cell from the T lymphocyte and the B lymphocyte. SCID affects the X chromosomes mostly in male, but rarely in female. Yes?
How was the name chosen?
People with SCID lack virtually all immune protection from bacteria, viruses, and fungi. And this, which was how SCID's name was chosen.
When was SCID discovered?
It was initially discovered in the 1950s. The first molecular cause of human SCID, adenosine deaminase deficiency, was found in 1972. Later, in 1993, a second fundamental cause of the condition was discovered as the molecular basis of X-linked human SCID.
Where was bubble boy's disease discovered?
Researchers found this disease everywhere where there was a newborn baby, male or female.
Who discovered bubble boy's disease?
Human SCID was first discovered by Swiss doctors Glanzmann and Reiniger in Switzerland during the 1950s.
What is a specific type of disorder?
X-linked severe combined immune deficiency, also known as SCID, and this is an inherited disorder of the immune system that occurs almost exclusively in males. Boys with X-linked SCID are prone to recurrent and persistent infections because they don't have the necessary immune cells to battle off certain bacteria, viruses, and fungi.
How is this disease inherited?
SCID is inherited in distinct ways depending on the type of gene and which gene is causing it. The most common method SCID is inherited is X-linked recessive. You can also inherit SCID in an autosomal recessive manner. For this kind of inheritance, the gene is located on the X chromosome, which is one of the sex chromosomes. Genes usually come in pairs, with each parent giving one copy to each child. The sex chromosomes, however, For this kind of inheritance, the gene is located on the X chromosome, which is one of the sex chromosomes. Genes usually come in pairs, with each parent giving one copy to their child. The sex chromosomes, however, are different. A female inherits 2 X chromosomes, one from each parent. When a female has an invalid copy of the gene on one of her X chromosomes, she will not have SCID. This is because she has a second and working copy of the gene on her other X chromosome. A male with an invalid replica of the gene for SCID on his X chromosome will have SCID. This is because he does not have a second X chromosome with a functioning copy of the gene.
Does that mean that guys are more likely to get SCID than girls?
Yes. It is more frequent for males to have X-linked recessive SCID than females. If a mother has one invalid copy of the gene, she is called a carrier. For carriers, there is a 50% chance that each male pregnancy will have SCID, and for the other half of carriers, there is a 50% chance that each female pregnancy will be a carrier, like the mother. A father passes Y chromosomes to his sons and X chromosome to his daughters. So if a father has SCID, none of his sons will have SCID, and all of his daughters will be carriers. No popcorn in class.
Miss Smith, do you have a picture of the disorders pedigree?
Yes. So in scenario 1, the mom is a carrier and has no symptoms, and the dad is a normal. The possible outcomes for their children are a normal girl, a girl that's a carrier, a normal boy, and an affected boy. Only boys can be affected. Since girls will always inherit a normal copy of the gene from their fathers, they can become carriers. And in scenario 2, the mom is a carrier and has no symptoms, and the dad is affected. And the possible outcomes for their children are a girl carrier, affected girl, a boy that's normal, and an affected boy. If both parents carry a copy of the defective gene, girls can be affected. The father will always pass the defective gene to each of his daughters.
What are the symptoms of SCID?
Failure to gain weight or not growing at a healthy rate, life-threatening infections that happen once are not treated quickly, and they do not get better with medicine. These infections can include meningitis, which is brain infection, pneumonia, lung infection, sepsis, blood infection, opportunistic infections, infections that do not cause in healthy people. These include pneumocystis, pneumonia, a specific type of pneumonia, fungal infections, viral infections. Other infections that may happen more frequently include otitis media, which is ear infection, sinusitis, sinus infection, skin rashes, infections, yeast infections in the mouth and diaper area, diarrhea, liver infections. Frequent and often very severe respiratory infections. Symptoms of SCID in infants include weak growth, rashes that look like eczema, chronic diarrhea, and recurrent thrush in the mouth. Also, sinusitis pneumonia. Early signs of SCID include high number of infections that do not improve with antibiotic treatment for 2 or more months, diarrhea, poor weight gain or growth, failure to thrive, thrush, a fungal infection in the mouth or throat that does not go away.
How do doctors determine whether or not a person has this disorder?
You mean this?
Yeah.
This diagnosis of SCID is usually first suspected in children because of the clinical features. Sometimes there has been a previous child with SCID in the family, and this positive family history may prompt diagnosis screening for SCID before the child develops any symptoms. One quick way to diagnose this condition is to count the peripheral blood lymphocytes in this child or those in the cord blood. 2 tests do this: the complete blood count, or the calculation of the percentage of each distinct type of white cell in the blood. The diagnosis of SCID can also be made before the baby is born, if there has been a previously affected infant in the family and if the gene defect has been detected. If the genetic analysis has been completed on the already affected infant, a diagnosis could be determined during subsequent pregnancies. You can do this by molecular testing of cells from a chronic villus sampling or from an amniocentesis, where a small amount of amniotic fluid, which contains fetal cells, is removed from the uterus. In a majority of cases, unless termination of the pregnancy is a consideration if the fetus is affected, the diagnosis is best made at birth on cord blood lymphocytes, because there is a risk to the fetus by the above procedures, or if blood is collected for lymphocyte studies where the baby is utero. Every diagnosis before the infant has had a chance to develop any infections is extremely valuable, since bone marrow transplant given in the first 3 months of life have a 94% success rate. In fact, screening newborns to detect SCID soon after birth has been made possible because of recent scientific advances.
Really? specific tests that are used in diagnosis?
Your baby's doctor will ask if your baby has had any early signs of SCID. If your baby has specific symptoms, your baby's doctor may refer you and your baby to a pediatric hospital for immediate treatment. If your baby's result for the severe combined immune deficiency SCID were out of the ordinary range, your baby's doctor or the state screening program would contact you to arrange for your baby to have additional testing. Follow-up testing will involve checking a sample of your baby's blood to see if his or her immune system is actually working. Genetic testing, also called DNA testing, can be done on a blood sample. Some states use newborn screening for SCID. A blood spot from a needle prick on a baby's heel is used to screen for many distinct conditions. Newborn screening detects SCID by looking for T cell receptor excision circles. Two types of testing are used to confirm SCID. These tests are called a complete blood count and flow cytometry. This needs a blood sample to measure the number of lymphocytes in an infant's blood. Newborn screening is a process of testing newborn babies for some serious but treatable conditions. NBS can include a heel stick, hearing screen, and pulse oximetry. Newborn screening varies by state.
What is the life expectancy of a child that has SCID?
They can live healthy lives if they are treated with BMT before they are 3.5 months old. BMT stands for bone marrow transplant. They have a 95% chance of long-term survival. BMT treatment after 3.5 months old leads to a 60 through 70% chance of long-term survival.
What are the limitations a person may face when having bubble boy's disease?
If your child's immune system is restored and is in good working order, he or she should be able to have a productive and active adult life, including having a family. If they don't have an immune system, then they can't go to school and are extremely susceptible to germs and getting sick.
How does this disorder impact the person who has it?
When the immune system doesn't function correctly, it can be difficult or impossible for it to fight viruses, bacteria, and fungi that cause infections. SCID is called combined immune deficiency because it affects the function of two kinds of infection-fighting cells. Understand that infants with SCID may have to endure many painful procedures and repeated hospital stays.
How does this disorder impact family members?
It can be stressful and challenging for the entire family. They also have to live with the fact that their child may not survive.
What are the current treatments for this disorder?
The only cure currently available for SCID is a bone marrow transplant, which provides a new immune system for the patient.
What are the current treatments for the symptoms?
Symptoms may include life-threatening infections that are not readily treated and do not respond to medications as they would in children without SCID.
What are some treatments that were used in the past?
The only treatment in the past was to live your entire life in a plastic bubble. They did not have options for the treatment.
Is gene therapy a possibility?
Gene therapy treatment of SCID has also been successful in clinical trials, but not without complications. It works only temporarily.
Are there any foundations or organizations that are researching SCID, and can you explain what they are working towards in the future?
St. Jude's Research Hospital is studying better treatments for children with X-linked severe combined immune deficiency disease. They are working on trying to improve the safety of bone marrow transplant.
What are the global contexts that you would use for this project, and explain the relationship to your project?
I think the global contexts are 1, identities and relationships, and 2, scientific and technical innovation. This relates to my project because I am learning about other people's relationship with their family and friends. I am also learning about people's health issues. There is also an advancement in science because in the past, the only treatment for SCID was to have them live in a bubble their whole lives. But now, scientists have discovered a new cure that is called a bone marrow transplant, which gives the patient a new immune system.
Can you tell me a story about an affected individual with SCID?
Aeon Ashman Isaacs was affected by the disease SCID. He became ill, and about a month later, he was diagnosed with severe combined immune deficiency disease. He was 18 months old and had already had 5 surgeries. Doctors had to determine his tissue type to find a possible donor. Without his known tissue type, they could not proceed with a transplant. Dr. Sheik came and asked about gene therapy because the transplant process came with many risks. She was immediately told not to do gene therapy because it was experimental and led to leukemia. Instead, she was advised to have Aeon's tissue typing done in the Netherlands. After waiting for 5 months, she finally received a tissue type and could start researching for a donor. Aeon finally received his new cells on Freedom Day, the 27th of April. Thank you for listening in class today. I will see you tomorrow, and we will go over pronunciation of medical terms.
Thank you.